Hi, good morning, good afternoon. My name is Jennifer Ortiz, and I will be presenting on the social welfare policy issue of unaccompanied migrant children and youth. CAPITA 2024 states this operation stands as one of the most inhumane policies the U.S. government has pursued toward a vulnerable population. Undocumented minors. Amnesty International states, in total, the Trump administration has now admitted to separating approximately 8,000 family units since 2017. Challenges. Many enter the United States after suffering dangerous migrant journeys, exposure to violence, trafficking, and prolonged family separation. Aside from that, they also have traumatic experiences that they have in their homelands. The Office of Refugee Settlement, ORR, has conflicting mandates. One of them being to provide safety and support to these children, and another one is to expedite the reunification processes to meet expectations and standards that they have. Being in federal custody, often these children lack proper food, they live in unsanitary conditions, and they face overcrowding. Some get placed in ORR foster homes, and some get placed in facilities. There are reports of 4,500 complaints of sexual abuse. Policies and practices have affected the well-being and safety of immigrant children and their families. There are various effects of these children being separated from their family. Some of them include trauma and pain, lasting mental health trauma, and it often causes confusion and misunderstanding for them. Many of them come seeking a better life, and what they get when they first come here is far from that. I will be talking about the unmet service needs that these children face while in federal custody and once they are released from federal custody. There is a significant gap in stable trauma-informed care due to inconsistent access to mental health and access to health networks in general. Needing to have safe environments for when they are in federal custody. So they often do not have safe environments. They don't feel welcomed in those environments, which can cause a lot of different things for them. They're often rushed in the family vetting processes, so that causes them to overlook safety risks that could be in these foster homes or in these placements that they're going to. There is currently no additional resources and support for once they leave federal custody. When minimal transition planning occurs, it causes for vulnerable children to enter communities without adequate follow-up. A vision for change. There has to be something done. It's not right that these children face these challenges when seeking a better life for themselves. There should be support for these children and youth in helping them feel safe after their long journeys and through their transitions here in the States. There should be humane and ethical systems that prioritize children's safety, healing, and long-term well-being. There should be identifying psychological distresses that they face, the medical needs and the cultural considerations. Comprehensive trauma-informed services can really benefit these children. Counseling in the child's preferred language, and trained interpreters. Culturally responsive mental health assessments, ongoing counseling, and development of appropriate supports for them. There should be reliable and transparent placement, a system that ensures that reunification only occurs when safety and stability is established. There should be continued community-based services after their release from federal care. There should be follow-up on case management, connections at school that they can make, other community resources that they can utilize. For caregivers, it is important for them to receive education on the trauma that they have faced that can help with their adjustment. A care-oriented model that focuses on rebuilding trust and stability for these children. Policy change. To create effective reform, meaningful and focused policy advocacy is needed to address structural barriers within OR and in federal systems. Policy change strategy. There should be advocating for revisions to the ORR and for federal child welfare standards. Social workers can advocate for establishing national requirements for trauma-informed care. Standardized placement monitoring across all ORR contracted programs. Furthermore, we can be building coalitions among immigrant rights organizations, legal advocates, and mental health professionals. Engaging in congressional representatives through policy beliefs, testimony, and advocacy campaigns. I believe that a big part of testimonies can make an impactful statements to the life journey that these children have faced, being able to influence how these representatives see this policy and the changes that need to be made. Social work values integrated. We are required to follow the code of ethics. In this situation, it would be human dignity, the importance of human relationships, and challenging social injustices. There should be cultural responsiveness, understanding and utilizing their migration, trauma, culture, language, and identity to shape policies and changes to improve their experiences. We can have an advancement on social justice by actively opposing policies and practices that are not ensuring children's best interest. Advocating to dismantle inequalities and marginalization in these communities. Furthermore, being able to continue to promote human rights, to advocate for the safety and well-being to be prioritized over political expediency. Recognizing that unaccompanied minors are resilient young individuals deserving of stability, compassion, and support. Summing up, for children, it is important that they know and understand their rights so that they can speak up and advocate for themselves. when necessary. Many times, undocumented children are unaware of how to vocalize their rights or even what rights they have. It is important that advocacy continues to happen to change and improve current policies and processes for these children and their families. It is important to create a world where all children have the opportunity to thrive and reach their full potential. Thank you.